And you've heard the stats in New York City. Hispanics represent the majority of deaths. In Milwaukee County, blacks are 25% of the population, but almost 50% of the cases and 75% of the deaths. So what's going on? Well, it's alarming, but it's not surprising that people of color have a greater burden of chronic health conditions. African Americans and Native Americans develop high blood pressure at much younger ages. It's less likely to be under control and does greater harm to their organs. Puerto Ricans have higher rates of asthma, and black boys are 3 times as likely to die of asthma as their white counterparts. As a matter of fact, I've been carrying around an inhaler in my pocket for 40 years out of fear of having a fatal asthma attack. It doesn't matter if you look fit, if you look young, you are still at risk for getting and spreading and dying from coronavirus. The chronic burden of medical ills is likely to make people of color, especially, less resilient to the ravages of COVID-19, and is possibly, in fact likely, that the burden of social ills is also contributing. Social distancing and teleworking we know are critical, and you've heard Dr. Birx and Dr. Fauci talk about how they prevent the spread of coronavirus, yet only 1 in 5 African Americans and 1 in 6 Hispanics has a job that lets them work from home. People of color are more likely to live in densely packed areas and in multi-generational housing situations, which create higher risk for spread of a highly contagious disease like COVID-19. We tell people to wash their hands, but a study showed 30% of the homes on Navajo Nation don't have running water. So how are they going to do that? In summary, people of color experience both more likely exposure to COVID-19 and increased complications from it. But let me be crystal clear. We do not think people of color are biologically or genetically predisposed to get COVID-19. There is nothing inherently wrong with you, but they are socially predisposed to coronavirus exposure and to have a higher incidence of the very diseases that put you at risk for severe complications of coronavirus. But as the Vice President shared on the call this morning, this history, and I want you to hear me say this, it does not have to be our nation's future. We're taking steps now in the midst of the COVID-19 pandemic to reach, protect, and strengthen all communities impacted by this disease, and especially our communities of color. I need you to know, you are not helpless, and it's even more important that in communities of color, we adhere to the task force guidelines to slow the spread. This epidemic is a tragedy, but it will be all the more tragic if we fail to recognize and address the disproportionate impact of COVID-19 and an array of other diseases and risk factors on communities of color. The task force and this administration are determined not to let that happen. The president, the vice president have said we will not let that happen. We can't fix these issues overnight, but I promise you we will work with your communities to quickly and meaningfully move the needle in the right direction.